been a lot of changes in pathology, in treatments. I think as we know, the kind of the most, let's say, last 5 to 9 years, we've really had a lot of development of new drugs, new imaging, new, the neck, the high grade. I'm not sure if they're talking about the neck, the carcinoma part, or the higher grade, well differentiated.
Right.
Either way, I think we are, because of that, we're learning more, and that kind of snowballs with trials and ideas and gatherings of these, and we identify more. This is kind of our story as rare cancers, right? We learn about something, we kind of build momentum, and new things come of that. So if you're looking for a specific time frame, I don't know. I'm not sure anyone knows, but I am really hopeful that this community drives things forward, and patients as well as healthcare providers. And I think just there's lots of different ways, right? Participation in clinical trials, talking to your doctor about that, going to these patient education conferences to learn more. It takes a while for new developments to happen, but we're all part of that. And I think it's happening so fast for neuroendocrine tumors that it's really fun to have, patients we've had patients for over 20 years that, the treatments today were not available at the time that we first met them. So I remain really hopeful. So I think this is too early to tell, and I'm probably not the best person to answer that question. I can tell you my own personal experience with that. We do have some patients that are kind of going for a second round, meaning they've had initially 4 PRRT treatments. That is what is FDA approved. And after some period of time of maybe some stability, we have some disease progression, and the question is, if you've had a good response to PRRT in the past, is that a good option? Is that a good treatment option again? And we don't have, so I guess I should say we're kind of doing that off label. That can be done or tested, but there's no, to my knowledge, there's no clinical information about that. We've had some patients do that again, usually not the next 4 cycles, but we'll do maybe 2, and kind of see from there. The one thing I do want to add to that is, and it's kind of along the lines of survivorship, and that is, we have to be careful how much radiation someone gets. So over your lifetime, there's fixed amounts of radiation. So we have to, it's not an endless supply that we can give you. We have to be really particular about how much exposure to that, because that in and of itself can create other kinds of problems, specifically like secondary cancers, like blood cancers down the road. So we have to always weigh the risks and benefits for that. I think that matters what type of hormone that's being secreted. We know that if it's serotonin or 5-HIAA, that does need to be, even though you don't have any evidence of disease or NED on imaging, that we still need to control hormones. So if you have an elevated, let's just use example, the serotonin, and if you have an elevated 5-HIAA, which is a urine test for serotonin levels, we know that the high elevation of serotonin can have impacts on our body. One specifically is a carcinoid valvular syndrome, where the elevated levels of serotonin can fibrose the valves on the right side of the heart, sometimes the left, but mainly the right. So we have to keep those in check, and we have to monitor that. That's actually, it's a great survivorship question, because sometimes, even though, treatment is so-called done, and
Right.
we need to manage like late and long-term effects of the cancer diagnosis and cancer treatment. So kind of hard to specifically answer her, but I'm hoping, I hope, Tanya, that kind of helps. Something definitely to talk to your healthcare team about, like what type of hormone, what is that going to impact, and they can help answer that. Yeah, Y90 is liver-directed treatment
Mm-hmm.
with radiation. So they use these beads, Y90. It's and again, really hard for me to answer these specific questions, because
Yeah.
I don't know where or how much, or did both sides of the liver get this. So kind of hard to tell. So your interventional radiologist, or whoever did that, if you're being evaluated to have it again, should have an idea. Again, this notion of we can only do so much to an organ or your body, like overall radiation. There's a kind of a limit that we can do. So
Got it.
it's a good question, and should be asked of the specialist that you're seeing. My best advice is to really understand what the intended surgery is, and what their anticipated recovery time and things that you can do to help with that. And then once the surgery is done, ask specifically what ended up happening, because sometimes we go in with an idea, and then you get inside, or it's a little bit more, a little bit less. And these things are good questions to ask, to know, and avoid. Actually, it's just more to empower your food choices and expectations, like monitor your expectations after surgery.